On this video, I'm gonna show you 3 different techniques on how to get a body temperature. But first, what is a normal body temperature? For an adult, it may vary from 97 to 99 degrees Fahrenheit, with an average body temperature of 98.6 degrees Fahrenheit. In a child, it may also vary from 97.4 degrees Fahrenheit to 100 degrees Fahrenheit. And anything greater than 100.4 degrees Fahrenheit is considered a fever in both adults and children. And first, we will do the oral temperature, or through the mouth. And we will be using a digital thermometer. And before doing any of this procedure, don't forget to perform hand hygiene and wear appropriate gloves. And make sure as well that you're working on a clean thermometer by using alcohol prep. And now, insert it over to its probe cover. As you can see, well, our room has just enough lighting for us to perform the procedure. And we need to explain the procedure as well to our client. That we will put the thermometer underneath the tongue for us to get the oral temperature. Okay, Sir Max, kindly open your mouth. And we will be placing this thermometer underneath your tongue. Once the thermometer is done, it will beep. Take the thermometer out of the patient's mouth and read it. Sir Max, your temperature is 36.5. When you're done, remove the probe cover. Wipe and clean the thermometer with a downward twisting motion, clean to dirty. Put back the thermometer in client's unit. Wash your hands. And transfer record to client's chart. Second method is rectal temperature. And again, don't forget to wash your hands and explain the procedure to your client. Wear your gloves and prepare your rectal thermometer. And have your patient position on their back with their knees bent. Drape a cover around your patient for privacy. Put the probe cover to your thermometer and lubricate it. Once you lubricate the thermometer, insert the thermometer at least 1 or 1.5 inches to the rectum and remove the thermometer once it beeps and read the temperature measurement. Remove probe cover and wipe the thermometer using your alcohol prep, clean to dirty. Wash your hands and transfer record to client's chart. For our third method, we will be doing auxiliary temperature. And again, don't forget to wash your hands and wear gloves. Make sure that the thermometer is clean and insert it over to a probe cover. Place thermometer in dry axilla, directed upward. Place client's arm across chest and wait till it beeps. And read it. Okay, your temperature, Sir Max, is 36.5. Clean thermometer using your alcohol prep. Place in container. Wash your hands and transfer record to client's chart. And this time, we will check the pulse rate. Of course, don't forget to wash your hands and explain procedure to your client. Sir Max, today we will check your pulse rate. Place your three fingers against radial artery. With gently pressure, feel for pulsation. And count the pulse in full minute. And while taking the pulse rate, note the rise and fall of client's chest with respiration. Count for 30 seconds and multiply by 2 for a full minute count. If you have your equipment ready, you can also check for blood pressure. Okay, Sir Max, we will now check your blood pressure. To conduct this procedure, less background noise is better so we can hear the pulse properly. Put on blood pressure cuff. Place stethoscope earpieces in your ears. Locate client's brachial artery, closed bulb or hand bulb, and pump hand. Place diaphragm of stethoscope over brachial artery. And release bulb slowly. Note first sound muffling and last sound heard. Remove cuffs from client's arm and earpieces from your ears. And wash your hands. You can now transfer record to client's chart. Sir Max, you have a normal blood pressure, 120/80. And now we will do the bed bath. First, we need to check our client's ability to participate. And in my case, my client is paralyzed from the waist down, so he can still help me when it comes into assisting himself. I have all the supplies I need. I'll just put it here. Of course, don't forget to wash your hands and wear gloves. Mr. Lee, we will now do your bed bath. Okay. Always remember that the privacy of our client is very important. In my case, I'm inside my client's room and I made sure that the door is locked. I have all the equipments ready beside me. Mr. Lee, I need you to lift your head so I can place the bath blanket. Also position your client near you. Now we will remove client's gown and underclothes. Spread blanket across client's chest. Make a mitt out of the washcloth. We will wipe the areas gently. First is the eye, from the inner to outer canthus. Next is the face, ears and upper surface of the ear. Washing the front and sides of the neck. Rinse and dry after washing. Next is the forearm and axilla using long firm strokes. Dries the hand, arm axilla of the forearm, and repeat the same procedure on the near arm. Wash the chest, breast, and abdomen thoroughly. Leaves the chest and abdomen covered while rinsing the mitt. Rinse and dries chest, breast, and abdomen. Remove the bath towel and replace the top sheet over the chest. Turn the client on his side with the back facing the caregiver. Spread the towel across the client's back and wash client's buttocks, back, and back of the neck using long firm strokes. Leaves the back and buttocks covered with a towel while rinsing the mitt. Dry back of the neck, back, and buttocks. Turn client to the supine position, keeping him adequately covered. Removes the top sheet from the far leg. Untucks top sheets under the near leg and up around the hip. Place towel lengthwise under the leg and expose the near leg and up around the other hip. Wash the far leg using the long firm strokes toward the center of the body. Rinse the mitt and dries them thoroughly. Replace the bath blanket, top sheet over the near leg, and help client put on clean gown. Position client comfortable in bed. And we're done. Mr. Lee, how do you feel right now?
So refresh.
Tub bath and shower. First, explain procedure to your client and prepare tub and shower area. Assist client to shower or tub room. Fill tub about half full with warm water temperature range of 100 to 115 degrees Fahrenheit, same with the water temperature for shower. Hang occupied sign on the door. Assist client with a shower and into rub. Assist client with drying and put on clean gown or pajamas. Assist client back to the room. Ready the shower room or stall for the next occupant and wash your hands. Bed making. This will cover closed bed, open bed, post-op bed, occupied bed, and stripping the bed. For occupied bed, we need to explain to the client what is to be done. Mr. Lee, we will now change your bed linens. These are the linens that I will use. Move your client to far side of the bed. We don't have side rails, but if side rails is available, use side rails to avoid patient from falling. Untucks top linen, fan folds toward the center of the bed, and tucks under client. Place and tucks clean linen on the bed, keeping the other half near the client fan folded. Now we'll help client to roll over into the clean and folded linen. And of course, make sure that side rails is up. And loosens soiled linens and remove from the bed. You can put this now to laundry hamper. And now it's time to change the pillowcase. Mr. Lee, are you comfortable with your position now?
Yes.
And now let's proceed to an unoccupied bed by starting on stripping the bed. Removes pillowcases and place them on chair or table if there's no laundry hamper available. Loosens the top sheets, cotton draw sheet, rubber sheet, and bottom sheet, moving around the bed from one side to foot on one side and from foot to head on the opposite side. Removes the remaining linen and place them in a laundry hamper. Handles linen correctly, avoiding shaking or tossing into the laundry hamper. And we will now do the closed bed, open bed, and post-op bed. Place bottom linen on bed and use centerfold as guide. Applies pillowcase correctly. And also put back waterproof pad or under pads if needed. Fan folds top linen at far side of foot or bed. And it's done. And now we will do the back rub. But of course, don't forget to wash your hands first. And again, privacy of our client is very important. You may also raise the bed of the client. And now let's position the client on the side of the bed. Rub client with lotion, starting at sacral area and moving toward neckline using long, firm strokes. Need a long shoulders. Does that feel better, Mr. Lee? Complete back rub, moving from shoulders to sacrum and back to shoulders. Replace covers. Reposition your client and return lotion. And wash your hands. Now we will do the oral care. First, wash your hands and gather equipment needed. Mr. Lee, we will now brush your teeth. Raise bed. And place towel under chin. Moisten toothbrush and apply toothpaste. Brush teeth of the client according to tooth brushing. Allow client to rinse with water. Wipe client's mouth. Rinse and return equipment. And wash your hands. But if your client has a denture, gather equipment including basin of water and assist client with removal of dentures. Brush all surfaces of dentures. Have client rinse his mouth. Rinse denture and return to client. Starting with upper denture first. Assist client to dry his mouth, and you may also offer some mouthwash. And we're done. And now we will do the hair care. Mr. Lee, I already washed my hands and we will do your hair care. Place towel, turns client's head on the side, and comb hair, starting close to ends and keeping hand between scalp and hair ends. Turn client's head in the opposite side and repeat the same procedure. Arrange hair, and remove towel. And we're good. Of course, don't forget to wash your hands. Assisting with the bedpan. Hi, Mr. Lee. Today, I will assist you with your bedpan. Since I already washed my hands, we can start. For your privacy, I'll cover you up with this blanket. I'll position your bedpan right now. Can you help me by lifting your hips? I'll just put this tissue beside you. Side rails up. I'll just put this tissue and bell beside you so you can call me if you need me, okay? I'll get back once you're done. You can leave now, and once you're back, okay, Mr. Lee, I will now remove the bedpan, but I need your help again, okay? Place cover of the bedpan and carry to the bathroom to measure and collect specimen of urine or feces. After washing the client, clean the pan thoroughly and return to the storage unit. Wash your hands and ask your patient, Mr. Lee, do you feel better now? I will assist my client with a urinal. I already washed my hands. Hi, Mr. Lee. I will assist you with your urinal. May I ask, which side do you prefer? Okay, I will put it here. And let me help you facing on that side. I already put the bell beside you, and I'll get back to you once you're done. Other patients may feel comfortable once we leave them, and we'll get back to them once they're done. Are you done, Mr. Lee? Remove urinal, place cover on urinal, carry to the toilet, and measure, collect specimen if ordered, clean urinal and return to the storage unit. Mr. Lee, now we will wash your hands. Do you feel better now? Okay, so once you're done, make sure that your client is comfortable, wash your hands, and record any pertinent observations. And now, we will do the perineal care. After washing your hands, explain procedure to your client. Hi, Mr. Lee. Today we will do your perineal care. Is that okay with you? On perineal care, we may perform on surgical client, non-surgical client, and client with catheter. For surgical client, remove dressings or pads, position bedpan, pour tap water or prescribe solution perineum. Follow with rinse if solution used. Wipe anterior to posterior with cotton balls. Replace pad or dressing using sterile materials. For non-surgical client, wet washcloth with warm water and apply mild soap or cleansing agent. For female, wash perineal area from anterior to posterior. Also pay special attention to clitoral area and labial folds. For male, wash perineal area gently, beginning with head of the penis and retracting foreskin. Continue down shaft, around penis, and posteriorly to rectal area. Rinse soap agents thoroughly from client. Dry area with soft towel. Replace foreskin for male client. For client with catheter, using swabs moistened with antiseptic solution, hold penis erect in male, and clean catheter insertion area. Retract catheter slightly and apply to catheter itself. Do not rinse. Apply ointment. Replace underpads. And make client comfortable. Dispose used materials. Wash your hands and record any pertinent. And now we will perform the range of motion exercise. Hi, Mr. Lee. Today we will do your range of motion exercise. I already washed my hands, and let's begin. Let's start on the neck. First, we will do the extension and flexion. Next will be lateral flexion. Rotation to the right. Rotation left. Next is for the shoulder. So flexion and extension. vertical abduction, and vertical adduction. Internal rotation, external rotation. And for the elbow, flexion and extension. For the wrist, flexion, extension, radial deviation, ulnar deviation. And circumduction. For the fingers and thumb, flexion, extension. Abduction, adduction. Circumduction of thumb. And for the hip and knee, flexion, extension. Abduction, adduction. Internal rotation, external rotation. And for the ankle, dorsiflexion, plantar flexion. Circumduction. And let's go for the toes. Flexion, extension. And I'm done. You can go and wash your hands. Moving a client in bed. Before doing this activity, wash your hands first, before touching your client. Raise the bed to high position. Now, we will move the client to side of the bed, closer to the caregiver. Grasp client behind far shoulder. Move client in one side of the bed. Raise bed to high position. Raise rail and move to the other side. Prepare pillows for support. Turn lower body. Move client's near arm out of client's way. Place client's far arm across chest. Raise side rails together with the other side as well to protect your client. Turning a client in bed from back to abdomen. Place client near arm close to the body. Roll client into side. Adjust position as needed. Position client correctly. Don't forget to check client's comfort. Supine position. Place client on back with spine in straight alignment. Keep legs straight. Side lying position. Turn client on side. Place low pillow under head. Place lower arm forward of body. Flex top leg and bring slightly forward. Place pillow lengthwise between legs. Flex and support and rest on pillow in front of body. Under tuck pillow along back. Prone position. Place client on abdomen. Turn client's head to one side. Place folded towel under each shoulder. Place arms flat at side or flexed at elbow near client's head. Place hand rolls if needed. Position client's feet in space between mattress and footboard. Positioning a client in a chair. Place feet flat against floor. Strengthen spine. Support elbows on arm rests. Fowler's position. Place client in supine position. Elevate head of bed 18 to 20 inches or 45 degrees. High Fowler's position. Place client in supine position. Elevate head of bed to angle of over 45 degrees. Orthopnic position. Have client sit up in bed with overhead table across lap. Pad table with pillows and elevate to comfort height. Have client lean forward with head and arms resting on table. Dorsal recumbent position. Position client on back. Raise knees and separate legs. Feet remain in position on bed. Lithotomy position. Position client on back. Raise knees and separate legs. If on table, place feet in stirrups. Sims position. Use side lying position with single pillow only under head. Turn far enough into abdomen so lower arms extends behind client's back. Trendelenburg position. Place client in supine position with head of the bed lowered. Tilt entire bed frame downward with head approximately 30 degrees below horizontal level. Use pillow to protect the client's head. Clean your hands with soap and water. You can also sanitize the area. selects appropriate size of the gloves, opens wrapper properly, place gloves with cuff toward body, grasp first glove, touching inside only. Turns to side of sterile field and pulls gloves on. Lift second gloves, slipping gloves, fingers under cuff, turns to side of sterile fields and pulls gloves on. Now I will show you how to properly remove your gloves. After use, removes gloves by turning them inside out without touching surface with the bare hands. Plucks either glove near the cuff, pulls the gloves over the hands so that the glove invert itself with the contaminated surface inside. Slides two fingers of the other hand against the wrist, under the cuff of the other glove, slides the second glove off, insert it over itself and the first glove. Discards the gloves in the designated container and put alcohol. Bandaging application. Open face triangular bandage. Cravat face. Roller bandaging. Spiral bandaging. CPR. Hey, are you okay? Call 911. No pulse. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. With ears over mouth, check for breathing. Hey, are you okay? With ears over mouth, check for breathing. Call 911. No pulse. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Check if the baby is okay. If it's not responding, call for help. Check the airways. Make tight seal on infant mouth and nose with rescuer's mouth. If there's no pulse, begin compression. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Hey, are you okay? Call 911. No pulse. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10, 11 and 12, 13, 14, 15. With ears over mouth, check for breathing. We need to change. I'm getting tired. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10, 11 and 12, 13, 14, 15. One and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10, 11 and 12, 13, 14, 15. Hey, hey, are you okay? With ears over mouth, check for breathing. Call 911. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10, 11 and 12, 13, 14, 15. One and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10, 11 and 12, 13, 14, 15. We need to change. I'm getting tired. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10, 11 and 12, 13, 14, 15. Foreign body airway obstruction. Stand or kneel behind the victim and wrap your arms around the victim's waist. Make a fist with one hand with quick upward thrust. Repeat until the object expelled. Now we will do the ambulation. Wash your hands first. Explain procedure to the client and encourage them to participate. With one arm under the client's back and one arm under the client's upper leg, move the client into the dangling position. You may use gait belt for support. Stand in front of client with your knees touching client's knees. Assist client to standing position. To avoid falls and trauma, support the client as needed. Transferring of client from bed to wheelchair. My client is paralyzed from the waist down, and we will do the actual transfer. Mr. Lee, I'll just get your wheelchair so I can assist you over, okay? Move your client on side of the bed in preparation for the transfer. Lock the wheelchair brake and elevate the foot pedal. Bend at the knees, easing the client into a sitting position. Assist client to maintain proper posture. Assisting a client with crutch walking. Apply the gait belt around the client's waist if balance and stability are impaired. Assist the client to a standing position with crutches. Support as needed. 4-point gait. 3-point gait. 2-point gait. Swing through gait.